Good afternoon, folks. It's Lowe's Logic. The way I see the world and the way I believe it sees me. Coming to you live from Washington, D.C. Today is Saturday, October the 15th. It's approximately 2:45 p.m. I want to talk to you today about something that is near and dear to my heart. It's a subject that has much attention around the country and in public health circles. I want to talk to you about health disparities. How is it that people of color and other poor peoples seem to fare worse than others within our society? Now, I'll go even a little deeper as I get into the topic, but what I want to also deal with is we now have evidence that money and education does not necessarily mean that African Americans will fare better in the healthcare delivery system. So simply put, we now know that middle-class educated African American women, and the most recent example that hit the media was Serena Williams, had a near fatal outcome from her pregnancy, the delivery of her baby Olympia. And so what do we learn from that? When we look at the data across the board, middle class African American and other women of color seem to fare worse than their counterparts. So let's get into it. What is the origin of health disparities in people of color and poor people? I want to start off by saying that I recognize that health disparities are not unique to people of color, but what we know is people of color tend to fare worse than their counterparts of equal education and socioeconomic status by virtue of those measures. We do know that enslaved people came to this country and they were treated like property. With that, the earliest example of the disparity was seen when these people were worked in the hot sun for long periods of time with little water and little food and basically treated like property. And then what we learned from that period of time is that there were examples in history cited that, you have an American physician, Samuel Cartwright, who came up with the hypothesis that when an enslaved person sought their freedom through fleeing their captors, that they somehow had a mental condition called Drapetomania. No, folks, I'm not making this up. There was a physician in this country who believed that if a slave wanted to run away, there had to be something mentally wrong with him because his conditions in slavery were far better than any other condition that they could face. Now, the good news is the medical community debunked this theory, and there are several citations that sort of just said, hey, this guy's not too well put together. This theory doesn't work. But we also have an example of a physician by the name of Marion Sims, who did, in fact, experiment on 3 slaves. And the experiments that he did literally were to improve upon his ability to perform certain procedures, and he literally performed surgery on one of them over 30 times. He quotes that in his book. And he thought he was doing good. He thought that he was in a position of helping the society by learning a craft. But the problem is he was treating his subjects as if they were a thing, an object, not as a human being. So we can move further on down the line to talk about a more recent, closer to period of time, and that was the Tuskegee experiment. Now, what's interesting about the Tuskegee experiment is that I literally had the opportunity to sit with 5 physicians in the early 2000s who had never heard of the Tuskegee experiment, and I thought it was a joke. And I was like, really? Now, it is interesting that within that group, there was one African American and then myself, and I just, I was really astounded that this wasn't common knowledge to that particular physician. And when I say physician, I'm talking about medical students, residents, and attendings. So for those who don't know, the attending is the highest, most seasoned, and the residents come up under the attendings, and you have to do a certain number of years of residency to become a physician, and then you have medical students. I called them all doctors, so by law they were not all doctors, just to be clear. Henrietta Lacks, if you've never heard of her, it's a Baltimore woman who was seeking treatment for cancer. During her treatment was found that she had these remarkable cells, and they actually have named these HeLa cells, I think. And there's a book and a movie on Henrietta Lacks, because her cells were so unique that her cells were sold millions of times to laboratories to develop treatments, cures, and understanding certain processes. So she has not received, she since passed, but her family, I believe most recently, is going to be compensated for that, and that was years ago. And let's talk about birth control. It's in Alabama history. There are two sisters, the Relf sisters, who in 1973, they were both 12 and 14 years old. They were sterilized. Now their family was receiving public assistance, and as a result there was a program in Alabama at the time that if you were poor and you had female children, to sort of end that poverty and limit the amount of health, the amount of human service dollars that go in that way, we're going to stop breeding these poor people. And they literally perform these procedures on these people. Now it should be noted that their parents were illiterate, and claims against the government in court stated that, you know, they gave informed consent. But later, you know, upon interviews and attorneys being involved, the parents, they didn't consent to their daughters being, for lack of a better term, sterilized. You know, I could go on about the past just to lay the foundation in terms of that there is noted history that there were were disparities in medicine. But modern day, you say. I mentioned the Serena Williams case, but there are data that support the fact that middle-class, educated African-American women have higher risk pregnancies than their counterparts of equal or lesser education and socioeconomic status by those measures. And that is alarming, folks. That is really alarming. We talk about mental health. You know, people of color tend to be at greater risk not to receive proper treatment, and or more likely diagnosed with schizophrenia and prescribed very powerful drugs for that condition, as opposed to their counterparts being diagnosed with bipolar disorder or depression and treated with other medications and or treatments. And interestingly, there's also this within the people of color, this belief that there is a stigma associated with mental health, and there is, but I bring that up because that's been cited as one of the barriers to people receiving the services that they need. Now, I would also add that mental health has also been criminalized with people of color receiving disparate treatment from law enforcement. This is research data, folks. This is not stuff I'm making it up. So if anything that I say, and let me be clear, I'm just offering information to enlighten you to do your own research. Prove me wrong, and I'd love that someone try to do that and we could have a dialogue or a discussion. But the reality is, if you don't know, you don't know. And I can't walk around with information assuming that this is common information to all people. So I just feel like this Saturday I'm going to spend a little bit of my time sharing this. And if no one listens, that's fine. If someone listens and learns, that's fine. If someone proves me wrong, that's even better, because then I'm educated. Okay, so let me move down to the fact that doctors, nurses, clinicians, and I'm talking across the board, not specific to any specialty, need specialized training and in cultural competency, understanding that implicit bias is real, and be able to accept that you possibly may have a bias towards someone who doesn't look like you, didn't grow up like you, doesn't sound like you, doesn't move like you. Now, if you can begin to accept that, it's not unnatural, by the way, because dogs don't usually live with cats, cats don't usually live with dogs. Now, people are not animals, but when we talk about color and the advent and addition of race into the question, the construct that is defined as race, separating people by color, skin color, and cultures, yeah, people have been taught that if someone's not like you, they're different. People have been taught myths about others. You know, there's a common belief that black people or people of color can withstand pain and have thicker skin. Somehow the color of their skin makes it thicker and thereby more likely needing less pain medication, coupled in with this bias that, you know, African Americans seek out pain medication to get high. Now, I would also like to add with that piece some very unique feature in current news, that we are now making the opioid crisis a health crisis, as it should be, as my granddaughter say, as it should, but also adding to that the fact that, you know, we had a really bad epidemic of crack cocaine right in our town and other towns around this country, and that was criminalized. Now, I struggle with the fact that maybe we were more ignorant as a society and we didn't know. But then I thought about opioids were not newly added as a social problem. You know, you had a lot of guys come back from Vietnam and they were exposed to heroin, which is an opioid, and they abused it heavily, leading to crime and other untoward impacts on society, by numbers, that is. But somehow we weren't astute enough to see opium and opioids as a public health problem then. I'm glad we see it that way now, and I'd like to hope that it opens the door for substance abuse discussions to be more less stigmatized and more open. We know and always have known that we've had a problem with alcohol in this country, and I should also add that people of color have tended to self-medicate. So rather than seeking treatment either because they're distrustful, it's not there, or it's not culturally sensitive, you know, go out and, you know, get your alcohol, get your smoke, get your snort on, get your pill, get whatever works for you. And when we talk about coping, substance abuse is this whole another discussion, because it has been used to self-medicate for people that I know personally, professionally, and it's a serious matter where people don't always get the mental health treatment that they need. And sometimes it's not a full-blown, you need antipsychotics. Sometimes it's just you need to talk to someone to help you deal with something that you're dealing with. And we could talk about trauma. I recently heard about a study, and I'm not specifically talking about mental health. I don't want to go too far off on a tangent there, but I heard that there was a study that I believe it was a mammal, I want to say dogs, cats, mice, I forget, they were exposed to cherry blossoms. And when they were exposed to the cherry blossoms, there was a negative stimulus added to them, i.e. they were shocked, poked, prodded, pain was inflicted upon them, such that when they saw cherry blossoms, they immediately experienced a heightened anxiety or a trauma-related experience. Now, what's interesting about that is that I believe it was 6 generations later that those same mice, generations later, that were not exposed to the negative stimulus, experienced anxiety when they were exposed to cherry blossoms. So I'm going to deal with that in a whole piece by itself one day, if God willing, and you all keep supporting me and showing me love. But let me just say that the future on improving upon disparities will require more financial commitment from insurance companies, government, and others. You know, there needs to The needs have to be addressed on the ground with refocusing on prevention, prevention of bias, scaled resource allocation, and definitely quality oversight of the services. Because a lot of money is out there. A lot of money is being paid. A lot of grants are being let for the removal of this problem. But what I need to just tell you is I'm tired of seeing where money, and I hate to see it, where money has been spent, lots of it, in removing problems, yet the problem still persists, and there's limited quality oversight from my perspective. I'm not criticizing anybody personally or professionally, and my views are purely as a citizen on a Saturday, seeking to share my experience. I just think we need to do better, folks, as a society, and whatever I can do, I'm willing. And I encourage you that, you know, how can you help yourself and your family? Learn as much as you can about your health, okay? Learn what causes problems in health for you, generally, racially. What health issues does your family face? And if you know that, right, you should be able to really kind of take strategic approaches on ensuring that you and your children break this cycle, is all I'm saying, right? You know, if you guys have a problem with hypertension, diabetes, heart disease, substance abuse, smoking, whatever it is, look at those babies, look at your children, look at their kids and say, hey, is this okay for them? Are we going to keep doing this? Or am I going to be the one that decides to change the trajectory of my family, my grandchildren, their babies? You know, I encourage people, teach babies to swim early. You don't want to be seeing a baby drown because you never learned how to swim, okay? It's a simple thing you can do. Our wonderful city, D.C., one thing I love about D.C., we have abundant resources for health, mental health, recreation. We here in D.C., we should be the model for the country with regard to many of the things that we do. I do see shortcomings too, but no one asked me my opinion on shortcomings related to some of the systems that I see. You know, get involved with community-based groups that are focused on the health of your community. Go to some of these free seminars that our fair city is adding regularly to help you learn about health, healthy cooking, healthy eating. Plenty of fitness classes out there. I know it because I know some of the people that run them. Cheap gymnasiums, walking in parks. You know, do teach your kids the history in terms of how they and other peoples of color and even poor people who are not people of color, you know, like, teach the history of how we failed groups along the way, because African Americans and other peoples of color are not the only ones who suffered negative impacts of these disparities. I want to be clear, all right? But with that being said, if we don't start teaching our kids that these are real moments in history that have occurred, we've done better in some areas and we've taken 2 steps back in others, right? And so teach that history, prevent disease and illness, move more, drink water, eat as well as you can, teach your kids good habits. So if you've got bad habits, you know, we all do. Try not to do them where your kids know that that's what you're doing so that they can see it, because I can tell you, you know, God loved all of my relatives, the ancestors have gone before me, but they smoked, they drank, they cussed, they fussed at the cookouts. You know, they did their thing. And we, being young, I remember buying candy cigarettes, of all things. Candy cigarettes. Figure that out. I can't. But at any rate, folks, I just want you to know that you can follow me on Spotify, Podbean, Apple Podcasts, Amazon Audible, iHeartRadio, Samsung Podchaser, and YouTube. And this has been Lowe's Logic. Keep your hearts, your spirits, and your minds intact. And please know that I love you. Please.